Sally Pipes is President and Chief Executive Officer of the Pacific Research Institute, a San Francisco-based think tank. Sally addresses national and international audiences on healthcare issues. She's been interviewed by John Stossel when he was at 2020, Lou Dobbs, Glenn Beck when he was at Fox. She's been on the O'Reilly Factor, Your World with Neil Cavuto, Nightly News with Brian Williams, The Today Show, Kudlow and Company, and one of my favorites would be The Dennis Miller Show. Was that fun?
Yes.
Oh, good. She has a regular column in Forbes.com, Piping Up, has written in the Examiner newspaper, Investor Business Daily, The Wall Street Journal, Washington Post, USA Today, Financial Times of London, The Hill, Real Clear Politics, New York Times, Los Angeles Times, San Francisco Chronicle, Sacramento Bee, U.S. News and World Report, and the Boston Globe. And I started to say, list the papers she hasn't written in. She's the author of the book, The Cure for Obamacare, The Pipes Plan, The Truth About Obamacare, The Top 10 Myths of American Healthcare, A Citizen's Guide, and Miracle Cure, How to Solve America's Healthcare Crisis and Why Canada Isn't the Answer. Obviously, we have here a very well-informed and reasoned voice to speak on the issue of healthcare. Ms. Pipes is a Canadian, and we're lucky to have her here now as an American citizen since 2006. Please give a warm welcome to Sally Pipes.
Well, good afternoon, and I'd like to thank Lowman Henry for inviting me here to Pennsylvania today. I'd never been to Harrisburg, so it's an experience. The weather's not quite as nice as it is in California, but as I was told last night, you don't have earthquakes here. What I would like to say is that I really believe healthcare reform is going to be the top domestic policy issue in our election this fall and also moving forward to 2016. As Greg Sargent, writing in the Washington Post the other day, said, get ready for 8 months of all Obamacare all the time. And I think we saw that on April 1st when the president was in the Rose Garden popping champagne bottles and with great fanfare saying, we made our goal. 7.1 million Americans are enrolled on the healthcare exchanges. Well, I say not so fast. Obamacare is vulnerable, and we need to fight so hard now against it. Repeal and replace is the only solution to the healthcare issue going on in this country. My Congresswoman, I hate to say it, Nancy Pelosi, although I don't vote in San Francisco, I work there, I don't vote there, she made that brilliant statement 11 days before Obamacare was signed into law. We have to pass this bill so that we can find out what's in it. Well, ladies and gentlemen, the American public is finding out what's in it, and they don't like it. 55% of Americans today still support repeal of Obamacare. And when they are finding out what's in it, canceled policies, 5 million Americans lost their plans. Premiums are up. Deductibles are up. The administration has issued over 30 delays, which are illegal because they're made by the administration, not through Congress. So we have a lot to fight for. What I like to say is understanding healthcare is similar to unraveling an onion. There are many layers and many tearful moments. But I do think that all Americans would agree we all want affordable, accessible, quality care. The question is, how do we achieve that goal? And there are two competing visions in this nation for healthcare reform. One which relies on empowering doctors and patients, the vision that I support and what Senator Toomey supports as well. The other focuses on increasing the role of government in our healthcare system through increased mandates, taxes, subsidies, and controls on insurance companies. Remember, the president said in the 59 speeches he gave that we have to have health care reform and it's going to be done by me. And in fact, he really wants Medicare for all, and he is the first president in 75 years who has been able to achieve taking over of our healthcare system, 1/6 of the economy in our country. We do spend 18% of our gross domestic product on healthcare, more than any other country in the world. But the Americans demand the best in healthcare. I'm from Canada, as it was pointed out. Canadians spend 11.4% of their gross domestic product on healthcare. How do they do that? Because the government is the only provider of health care, and the government says that is what we are going to spend on health care. But what does it mean when the demand for health care is greater than the supply? Long waiting lists for care. The average Canadian today waits 18.3 weeks from seeing a primary care doctor to getting treatment by a specialist. This is what I worry about for the future of our health care if we do not repeal and replace Obamacare. Canadian healthcare rations care, and there is a lack of access to the latest technology and treatments because of government control. So this is something that we have to fight for. Polls show, according to Deloitte in their 2013 study, 60% of doctors polled say they're going to retire in the next 1 to 3 years because of Obamacare. What does this mean for the future of us if a lot of doctors are retiring early? The American Association of Medical Colleges says we will have a shortage in this country by 2019 of 130,000 doctors. Half will be primary care and half will be general surgeons. So the best and the brightest as well are not going to go into medicine, and that impacts the quality of care that we are going to get. The president had two main goals for Obamacare. One was to achieve universal coverage. The other was to bend the cost curve down. Neither one of these goals, we just celebrated the 4th anniversary of Obamacare on March 23rd, neither one of these goals is going to be achieved. The Congressional Budget Office has predicted by 2023, 31 million Americans will still be uninsured. As well, on the cost side, the president wanted a health care law that cost $900 billion over 10 years. The CBO said the final bill was $940 billion over 10 years. Last year, Obamacare was costing $1.8 trillion over the decade 2013 to 2022. And myself and a number of other economists agree that this legislation will probably cost $2.6 trillion between 2014 and 2023. So the cost curve is not coming down as well. And remember also, the president said during many of his speeches, the average family will see their average premium decline by $2,500. The CBO said even before it was passed into law, the average family will see their premium go up by $2,500. There are many parts of Obamacare. I have about 17 pillars, which I'm not going to go through today because I only have 20 minutes and want to leave some time for questions. But the individual mandate was a key part of the legislation. And so that was supposed to come into effect on January 1st of this year. So if you were not able to show that you had health care, you would face that individual mandate penalty of $95 or 1% of income. Well, as part of the 30 delays, the administration said, we're going to extend the January 1st deadline to March 31st. And then, of course, on March 25th, they announced that if you were trying to purchase health insurance on one of the exchanges and couldn't, then you will have until April the 15th in order to actually enroll in a plan. And then 13, that was on healthcare.gov, then 13 of the 14 state exchanges announced that they would also allow people to delay until April the 15th. Healthcare.gov is the government's exchange, and I believe Pennsylvania is part of healthcare.gov. You didn't set up your own exchange. There are 36 states that didn't, and I am sure that the president had no idea that every state wouldn't rush to set up their own exchange. 14 states and the District of Columbia, of course, have set up their own exchanges. So when the president announced that they'd met that goal on April 1st of March 31st, when he made the announcement from the Rose Garden, 7.1 million had signed up. And as I said, everybody was just gloating with the excitement of reaching that goal. But what they didn't say was that about 20% of the people who have signed up have actually not paid the first premium. And that number is significant. We also know that according to McKinsey, the consulting firm, only 27% of the sign-ups were people who were previously uninsured. So, you know, these are very important points. The third most important point about that 7.1 million number is, what about the young invincibles? And I'm no longer a young invincible. I've passed the age of 34. But the issue is that only 25% of the 7 million people are the people between 18 and 34. The interesting thing is that 69% of the people who signed up are between 35 and 65. So we have a real problem, perhaps a death spiral, because if the young and the healthy do not sign up for coverage and the older and sicker people are making claims on the insurance companies, this is no way for insurance companies to stay in business. And Mark Bertolini, the head of Aetna, made that very point, that if we don't have enough young people to cover the claims of the older people, and if HHS doesn't let us increase our premium costs, how can we stay in the exchange? And also, how can they actually ever stay in business? During the run-up to the March 31st deadline, the administration spent over $700 million trying to get young people to sign up. They used people like LeBron James, Kobe Bryant, Eva Longoria, all of these people. But as I say, the young people still have not bought in. The average premium for a silver plan for a person age 30 is $240 a month. Can you imagine if you could get away with paying $95 as that individual mandate penalty? Young people are not going to sign up under Obamacare. And of course, 5 million people had their policies canceled, and the president was really in a fix. Everybody was up in arms. And it goes against his very important statement: if you like your health insurance plan and you like your doctor, nothing will change. Well, 5 million people found out that that was not the truth. The employer mandate. After saying that the employer mandate would come into effect on January 1st, 2014, the administration said, well, we're actually going to delay it till January 1st, 2015, because employers are finding it difficult to deal with this. And then on February 10, they announced that the mid-sized employer with 50 to 99 employees has for a whole nother year the opportunity to sign up. I don't know if you saw Robert Gibbs yesterday, Obama's former press secretary. It was in Colorado, and he said, well, I think the employer mandate is actually going to be scrapped fully. So we shall see. I'm sure the president and Jay Carney were probably, trembling, thinking that the former press secretary would say something as audacious as the employer mandate will be scrapped. About 160 million Americans have employer-based coverage. McKinsey has said that 1/3 of those people are going to lose their health coverage under Obamacare, because of the employer mandate and the increased cost of coverage. Deloitte did a survey just a couple of weeks ago of CFOs, chief financial officers. 40% of U.S. companies said they are going to pass on or consider passing health care costs onto their staffs. And some are going to pass it on to consumers as well. Many companies already have made changes to their health care plans. Home Depot is ending medical coverage for its 20,000 part-timers. Trader Joe's, Target, many of these companies already in advance of the mandate going into effect have made changes to their health care plan. Many economists, myself included, believe that if this law is not repealed and replaced, we are going to be in for a public insurance option, a Canadian-style Medicare for All system, because the insurance companies are not going to be able to survive. And that is what the president really wants in several speeches. Before he became president, he said he supported a single-payer system. Harry Reid, Senate Majority Leader Harry Reid, said in August on public TV, do you want to see insurance companies as the way to for people not to get health care coverage. He said yes, yes, absolutely yes. So you know that these people are going to say that if insurance companies get out of the exchanges, they're going to say, we tried the competitive marketplace, it didn't work, and therefore we need what they want is a single-payer system. We've had many delays, as I said, 30 delays, whether it's the cap on out-of-pocket expenses, the employer mandate, the individual mandate, the problems with the shop exchange, income verification for the subsidies for people earning between 138 and 400% of the federal poverty level. So many delays because Obamacare is not working, and the American people know it's not solving some of the problems we have with health care. There are two important cases going on right now. One is the case Halbig versus Sebelius in the D.C. District Court of Appeals. The case was just heard on the 25th. We expect a decision fairly soon, but that's over the fact that only states that set up their own exchanges would be for their people entitled to get the subsidies, and not people who are in the federal government exchanges. So that decision, we're awaiting that. And of course, the U.S. Supreme Court last week also heard the opening rounds in the contraception case with Hobby Lobby and Contessaga Woods. So that decision will probably come down this June. But if either of these cases go the way I hope they will go, these are going to be two other major death knells into Obamacare. The President, Harry Reid, Nancy Pelosi, these people, it's not really just about health care. They're progressives. They want government to make decisions for all of us rather than us making decisions for ourselves. They really believe that government is the only body able to decide what is best for us. So, in a way, the era is back, and we have to reverse this. When former Speaker Newt Gingrich was speaking at GOPAC in August in Boston, he said the problem is the Republicans have no health care replacement plan. Well, that isn't correct. There are many plans out there. Senators Coburn, Hatch, and Burr have a plan. Eric Cantor and John Boehner, Paul Ryan. Cantor and Ryan are coming out with a new plan shortly. Bobby Jindal came out, Governor of Louisiana, yesterday with a plan. There are a lot of plans out there. The problem is the Republicans can't seem to rally behind one plan and say, this is what we stand for, this is how you are going to have the kind of health care that does achieve affordable, accessible, quality care. So they've got to get their act together. They're all acting like cats in a laundry bag, and nobody seems to be able to rally around that plan. Thank you. It's a good thing that I'm Canadian. I can't run for president. And I'd never be on the vice presidential ticket either. I could never say the kinds of things I like to say. So what should a long-term replacement agenda look like? Well, we need to empower doctors and patients, as I said earlier, not the federal government. You know, the federal government got us into this mess during World War II when wage and price controls were in. They gave employers the ability to write off the cost of their health care, and we as employees got our health care with pre-tax dollars. But if you lose your job or you quit your job and you go into the individual market, you have to purchase your health care with after-tax dollars. If we could make that one change to the tax code, we would really see a tremendous increase in building up of individuals owning their own health care rather than getting it through their employer. And there is a lot of support in the polls for changing the tax code, and even a number of Democrats support that. I think that if the feds had wanted to do something, they should have put $25 to $50 billion into the high-risk pools, so states that didn't have a high-risk pool could set them up, and those states that have them, they could be enhanced, so that until we get a properly functioning market, those people who are chronically ill or with pre-existing conditions could get coverage until we have a market that works. We need state-based medical malpractice reform. The cost of defensive medicine in this country, according to PricewaterhouseCoopers, is about $210 billion a year. Remember when the president said over and over, doctors do all these tests because they want to line their pockets with a lot of money. Doctors practice defensive medicine because they are afraid of being sued. When Texas changed their medical malpractice law capping non-economic damages and punitive damages, 16,000 doctors went back into Texas. If you're a neurosurgeon or an obstetrician, chances are your med mal is so expensive in this country that you will get out of the practice of medicine. We need to make insurance portable. People should be able to take their insurance with them. We need Medicare reform. Paul Ryan talked about this a lot during the campaign. We need premium supporter vouchers, means testing, raising the eligibility age. When Medicare came into being in 1965, people only lived to 65. Today they're living to 79.5, and it's a tremendous pressure. Why should someone like Warren Buffett be eligible for Medicare? He shouldn't. So these are the kinds of changes we need, because the Medicare trustees say Medicare will be bankrupt by 2024 at $1 billion a year, $1 trillion a year if we don't make those changes. Medicaid, 4.5 million people have signed up apparently for Medicaid under Obamacare. We've seen already in Massachusetts that a lot of the people that signed on to Medicaid cannot find doctors, or the waits are too long. As a result, they're turning up at emergency rooms. We are going to see more emergency room use unless Obamacare is repealed and replaced. We also need to expand health savings accounts. That is the way to put individuals in charge of their health care. The question I ask is, who do you want to be in charge of your health care? A government bureaucrat, an HMO bureaucrat, or do you yourself want to be in charge of your health care? Danny Williams, the former Premier of Newfoundland, when he was diagnosed with a heart problem that he couldn't get done, the operation done in Newfoundland, he was going to be on a very long wait list in Toronto, and his doctor said his health was at risk. Danny Williams went to Mount Sinai Hospital in Florida, in Miami, and he paid out of pocket for his surgery. He came back. The Canadian media were all over him. How could you possibly go to the evil United States and pay to have the surgery done? Danny Williams said, "It's my heart, it's my health, it's my choice." Universal choice is the key to universal coverage. Like welfare reform, this is a long-term fight. If this legislation is not repealed and replaced, I believe we will be on Hayek's road to serfdom, and there will be no off-ramp. The Obama Victory March is definitely premature, and it is repeal and replace is the only solution. As my friend P.J. O'Rourke says, if you think healthcare is expensive now, just wait until it's free. Thank you.